My name is Dale Gibbs. I'm CHI Nebraska Director of Telehealth. I've had this actual position for not quite a year now, but prior to that I was Director of Telehealth for Good Samaritan Hospital in Kearney, Nebraska. Telehealth is the future. It's just the future of rural healthcare. It's a future of urban healthcare as well. Especially with the mobile technology now available, that's such a huge thing. Without the bandwidth to do that though, we don't have telehealth. So the bandwidth is the key to it, and the Public Service Commission is dedicated to providing that bandwidth, not only for telehealth, but for education and everything else. That's huge for a rural community. Telehealth is interactive audio and video in real time, and it's dedicated to the health of the populations. Well, without it, we would not have telehealth. We need the high capacity bandwidth. We need the T1 lines, the fiber, to carry video and audio at the same time. And the same speed going out is coming in, so that it's real time. So the telecommunications infrastructure we have is vital to telehealth. Telehealth in Nebraska is used for just about any way that we can think of, actually. It's used for meetings across the state, reducing the travel and the time it takes to travel. It's used for education, when we can provide education services, education courses from one hospital to the rest of the state to a specific population: nurses, paramedics, lab technicians, maintenance people, whatever it is. And then the number one use is for patient care. Patients don't have to travel hundreds of miles to see a specialist. Specialists don't have to travel to see those patients either. They can use telehealth to do that. Well, telehealth brings better health care to rural America that maybe was not there before. It also allows the hospital in that rural community to have a reimbursement process where they might not have been able to charge for that patient before because that patient wasn't seeing a specialist. So without that extra revenue, the hospital would suffer. Their expenses might get out of control, and the hospital might have to close or cut back on services, which has a huge economic impact to that local community and the hospital and the county. Well, it kind of goes back to if you start the care early on in a disease process or an injury, then the care is less costly in the long run, and the specialists in the urban area then have a bigger population to work with as well. I don't believe that it would be as viable at all. It wouldn't be statewide, I'm pretty sure, because the Public Service Fund helps with routers, and also in every hospital has to have a router in order to make sure that everything is secure and routed the right direction. It helps the small hospital in that it gives them a little bit more money to help offset the cost of that T1 line that they've got coming into the hospital, which then is used for telehealth. It would be very hard to continue in growing. It would be very hard to grow as well. The funding helps keep the cost low enough to where people can seek health care in a tertiary care center through telehealth.